Hi. What are the situations where I might give somebody a lower dose of anti-wrinkle treatment, also known as botulinum toxin treatment? In Ireland, this is a prescription-only medicine and you need to see a medical doctor or dentist for a face-to-face assessment. Anything else is not legal. So if I've assessed somebody, they're suitable for treatment and they want to go ahead. If they're completely new to me, I will generally tend to use a lower dose and invite them back 2 to 3 weeks later for a review. And I can adjust the dose and add more if I need to, but I can't take it out. For somebody new, while I'm assessing their muscle bulk and pattern and strength and their individual preferences, I go a little bit more gently and review. Equally, if somebody has never had botulinum toxin before, I'm going to go a little bit gentler because I want them really to get used to it and see if they like it. It's quite a difference if you've never had toxin and say you're 40 years old and your muscles have done their own pattern of making expressions for 40 plus years, and then we're coming in with a medical intervention and we want to make those muscles quieter and soften the expressions of negativity, say for example sadness or anger, that come with those muscles. I want to go gently and just make sure that that's appropriate for them. Also, I think I see 95% women and 5% men in the clinic, and a lot of mums, they need to be able to communicate non-verbally with their kids. You don't want a mum communicating with young kids where they've got no expression whatsoever and the child isn't able to pick up those non-verbal cues of mum looking a bit sad, looking a bit surprised, looking happy. All of those emotions, it's so critical that we are able to communicate effectively, and our face is such a symphony of muscles that work together. We don't want to freeze somebody or do too much there. Another situation is teachers, and again, because they have such an influence on young minds and they want to be able to maintain some expression so the kids can pick up those cues from them. Also, if I see people who are in media or TV work, I tend to reduce the dose a little bit because, again, if they're reading the news, they want to be able to look surprised, look pleased with the sports score, look serious if there's a tragedy. All of those emotions are really important that they can then pass those on towards their viewers. Again, sometimes I find millennials and kind of older millennials, they're nervous of it and they want to try a smaller dose, and that's appropriate. But the beauty of it is you get to know somebody's face over a period of time, what their wishes are, what they're trying to achieve, and you blend that perfectly with their dose. Take care. Bye.